Injuries to the heart and injuries to the great vessels that are lying in the thoracic cavity are the highlight for the thoracic injuries. Whenever the thoracic cavity is penetrated or the perforated, these heart and the great vessels are in danger for the injury. So they are very important, and they are the basically the greatest complications that can occur through the thoracic injuries. So they are discussed in detail in this section over here. We will be discussing the stab wounds and the blunt injuries in detail over here. Stab is again basically it is an injury that has a more perpendicular area rather than the more linear area. So the perpendicular area is basically the more the structures it is going to damage. For example, the heart can be penetrated. For example, all the great vessels, the subclavian artery, the pulmonary trunk, the axillary artery, all these main vessels that are lying in the thoracic cavity, they can be damaged, and they can be very debilitating to these stab wounds especially. Talking about the blunt injuries are again, they can be the steering wheel injuries that can be encountered through any road traffic accidents, and they can be basically again be damaging to the heart and to the vessels. In a lot of cases, internal hemorrhages can occur, and internally infections can occur through these blunt injuries as well. Talking about the hemopericardium is basically the blood in the pericardial cavity, and what is basically the complication it can lead to? It is going to restrict the movement of the heart, and this restriction can again cause can be very fatal for the patient. The cardiac tamponade is the collection of blood in the fluid to a very fatal extent, and is a very complicated condition and has its own management criteria. Then we have the injuries to the great vessels. Great vessels are, which we refer to this, basically this word refers to the subclavian artery, the pulmonary trunk, the axillary artery, all the arch of aorta. All of these are the major vessels that are lying in the thoracic cavity, and that can be damaged through this debilitating injury. Now, talking about the injury to the heart, the heart is very vulnerable to both penetrating and the blunt injuries. It is a very delicate organ, and it is basically lying in basically the rib cage is providing protection to the heart. So in cases where the ribs are fractured or there is a flail chest conditions, the heart is at a very vulnerable position to be damaged. Basically, the entry point may be anywhere over the pericardium, and the adjacent areas can also be involved. The sternum can be penetrated in a lot of cases. The ribs, again, I was talking about, they're the main protective case. So they can be damaged, and again, the heart will be at a vulnerable position. So most stab wounds enter the intercostal spaces and through a rib or the costal cartilages. These are the entry points that are the most vulnerable points that we are talking about whenever the heart is injured. So the injuries to the heart can be a stab wound causes injury to the right ventricle. All the structures of the heart are at stake, of course, but again, the more delicate organs can be the right ventricle, the anterior interventricular septum, and the left ventricle, and they are the more fatal injuries that can occur to the heart, and that will basically complicate the situation more, and we'll be dealing with a more shocked patient. And obviously the management will include the double bore cannulas and basically passing on the shock phase for the patient, because that will be the mainstay over here whenever the heart is injured. Now, the stab injuries to the ventricles. Whenever we are talking about the stab injuries to the ventricles, it's basically the right ventricle why is it more vulnerable? It is basically thin-walled, and the knife passes into the heart cavity. What happens after that is copious amount of blood is basically present in the pericardial sac, and again there is some sort of a hemothorax kind of a condition. There is copious amount of hemorrhage. The infections can be more in such a person, and so this basically the right ventricle is a very fatal kind of a injury that we are dealing with. Now, what happens in the left ventricle injury? The layered thick wall may partly or wholly seal the wound. This is basically the condition in which the left ventricle is damaged, and the bleeding is very slight in such cases. As in the right ventricle, if we basically compare these two injuries, the right ventricle had a lot of bleeding, and on the left ventricle, basically the bleeding is quite slight, but the damage again is very important and is very complicated. So these has to be differentiated, and these basically they have their own complications. Now, the blunt injuries to the heart can be damage in intact chest cage. It can occur, of course. The fatal blunt damage of the heart can occur in such cases. And the posterior bruising and the laceration is another phenomena that is seen in such blunt heart injuries. Blunt heart injuries, as I've already referred to as, these are basically the road traffic accidents in which the front seat passengers have the blunt trauma to the chest. The ribs are fractured, of course, and they can have their internal impacts as well. But again, the injury is not perforating or penetrating kind. So the bruising and laceration is over there and can be seen in the heart as well. The interventricular septum may be ruptured in such cases, and that again is going to complicate the situation. The avulsion from the root of the heart is another complication that can occur in such injuries to the heart. Now, hemopericardium. Hemopericardium is defined basically as the collection of blood in the pericardial space, and again it is going to restrict the movement. Bleeding can escape into the pleural cavities, it can escape into the mediastinum, and even abdomen if the diaphragm is penetrated. So these are the conditions basically which we will be dealing with whenever there is blood in the pericardial space. The causes of the hemopericardium in such cases it can occur through any natural disease, of course, and it can basically occur through the ruptured myocardial infarct. It is again another phenomena which can be seen. The myocardial infarct, if it has already been present in a heart, it is going to basically make the heart more vulnerable to this hemopericardium condition. Now, the ruptured dissecting aneurysm of the arch of aorta that is present over there, it is also very important over here. Whenever there is hemopericardium, it can be caused due to the arch of aorta, or any aneurysm which was already present pathologically over there can contribute to this blood collection. Now, the sequel to the injury, trauma is obviously one of the causes, but we have seen that there are other causes as well. There are conditions that can be some birth defects, for example, aneurysms, it can be a ruptured myocardial infarct, or it can be any natural diseases. Now, cardiac tamponade is basically the restrictive kind of a condition in which the heart movements are restricted to the collection of fluid. So the blood accumulates in the pericardial sac faster than it escapes. It's basically this imbalance between the presence of the blood rather than its escape. And in bleeding from a contusion or laceration of the heart, no escape route from the sac occurs. The pressure in the pericardial sac increases. It prevents the passive filling of the atria during the diastole. The cardiac output basically falls over here whenever we are countering any situation of the cardiac tamponade. So you can see over here, it's basically an echocardiogram which is showing the restrictive movement that has happened during this cardiac tamponade. The movement of the heart is restricted and is kind of an irregular kind of a movement. That is basically going to be diagnostic for this cardiac tamponade. Now, injuries to the great vessels. The aorta is basically commonly suffering this injury to the great vessels in the deceleration trauma. Severe traction on the root of the heart is the cause to it, and complete or partial rupture of the aorta in the descending part is again the causative factors for these injuries to the great vessels. Now, the lower thoracic aorta is very vulnerable, and closely it is bound to the anterior longitudinal ligament. So this is basically the structures. The weak point and the transaction occurs at this level. At this level, when it is closely bound to the anterior longitudinal ligament, this is the most weakest point for the lower thoracic aorta. It looks like a surgical incision, because it is very clean cut over there, and the tear is annular and at right angles to the axis, and maybe multiple parallel intimal tears, which are these parallel intimal tears, a term is used for them which is known as the ladder rung tears. So these are used and these are seen in these lower thoracic aorta. So in the deceleration trauma, incomplete tears of the aorta takes place, only the intima and the inner media are involved, found without major transection. Death is delayed in such cases of the tears of the aorta, and the false aneurysms can also be diagnosed, although it is just the tear to the aorta. The dissections may be diagnosed on aortograms. So the pulmonary artery and the vein branches may be damaged. The great vessels, as we were talking about, are these: the aorta, the pulmonary trunk, the common arterial trunk, and the solitary arterial trunk. So we have to keep all these trunks in our mind, and these can be damaged whenever we are referring to the injuries to the great vessels. The stabs can pass directly into the arch of aorta, and other stab injuries wounds may injure the heart vessels, and it may also enter the large primary branches of the pulmonary artery or the veins, which can again result in gross bleeding. So these are basically the structures that are causing the injuries to these great vessels, and all these structures, the heart valves, the heart chambers, they're really vulnerable to all sorts of trauma. So in this section, basically, we dealt with the heart injuries in general and very comprehensively, of course, and how are we going to deal with these injuries and what are the complications to these injuries to the great vessels. That is the end to this section. Thank you for watching sqadia.com.